Hi, today I would like to talk to you about a very important subject for any woman with endometriosis, and that is the natural versus pharmaceutical treatment approach. A lot of you who first hear your diagnosis from the doctor might wonder, what are my treatment options? Well, I'll attempt to touch up on the options available to you in this video so you can be a better informed patient and also make the decision that you feel is right for you. Hi, I'm Izzy from Endo360 Help. You can find me on YouTube, Facebook, Instagram, and also on my blog where I write extensive articles about the usage of natural treatment methods in endometriosis, approaches that have worked for me and also that have been clinically proven to help with easing endometriosis symptoms. Now, because a lot of you, especially those who are new to endometriosis, are struggling with choosing between natural or pharmaceutical methods that doctors so openly prescribe, I wanted to put together this video to hopefully demonstrate to you more clearly the pros and the cons of both, so that you can make a better informed decision for yourself and for your health. Please note that this video doesn't look into the aspects of surgery, as it will be covered by a different video. Now let's start with a very important and one of my favorite wellness quotes from Hippocrates, who once said, "Nature itself is the best physician," which is something I would like you to keep in mind as we go along through this presentation. Now, there are a number of natural treatments available for endometriosis. The most important one of all, and one I definitely recommend you start with, is an anti-inflammatory, low-sugar, gluten-free, low-processed foods diet. Many call it the endo diet, which isn't necessarily all vegan, but it does heavily focus on eliminating dairy, red meat, and sugary foods, and makes fruits, vegetables, and healthy grains the core of your nutrition. If you want to know more about this diet, you can check out the articles on my blog where I reference reliable sources while looking through the foods that you should and shouldn't eat with endometriosis. Another natural option that your doctor won't likely mention is strengthening your immunity and lowering inflammation by the proper usage of certain supplements. Those include a whole list of vitamins and minerals such as vitamin D, C, E, and B group vitamins, as well as microelements like iron, zinc, magnesium, selenium, omega-3 fatty acids, and fiber that can help with various aspects of endometriosis symptoms. It also includes dried and whole food supplements such as macaroot, chlorella, spirulina, and ones that can specifically target chronic pain responses such as CBD oil. Another natural option is the usage of herbs that include dry herbs, tinctures, herbal teas, and infusions. Some of the herbs beneficial for endometriosis can help with reducing pain and inflammation, detoxing the liver, or calming the nervous system. Examples of these are dandelion, milk thistle, yarrow, cramp bark, or chamomile, and many more. Contact a reputable herbalist that can prepare a tincture or a herbal tea blend based on your symptoms. Another option is traditional Chinese medicine, or TCM. It's an option that I personally recommend you give a try. This method can include drinking Chinese herb mixtures or acupuncture to help manage flow of qi energy, strengthening the liver and spleen, nourishing the blood, and removing blood stagnation. When choosing this option, it is good to pick an experienced practitioner that helps with women's reproductive diseases and infertility. To learn more about this method of treatment, read the articles on my blog or watch my interview with Dr. Yuan Ting, who specializes in treating patients with endometriosis and other diseases that affect fertility using traditional Chinese medicine only. Now, another option is detoxing. They can of course include juicing, fasting, but also aspects that are not often talked about, like removal of hard metals from the body and removing all the passive toxins in the household which contain harmful chemicals that disrupt the endocrinological system. Those harmful chemicals such as BPA, parabens, SLS, and many others can be found in plastic food containers and water bottles, kitchen goods, cosmetics, and cleaning supplies. So that's another aspect of how you can help your body deal with endometriosis by going through a proper detox. Exercise. Lighter exercise, one that focuses on reducing stress, heavy breathing, and opening up the pelvis joints and muscles, is strongly recommended for endometriosis. On my website, under the Media tab, you'll find some exercises that concentrate on heavy detox, breathing, stress reduction, as well as increase of blood circulation and gentle opening of the pelvic region. Massage, reflexology, and meditation. These methods are a fantastic way to relieve stress and muscle tension. Reflexology, which is mainly done by putting pressure on different parts of the foot, can help relieve period pain, fight depression, and help with proper detoxification and organ functioning. Tui Na, a Chinese art of massage, works a bit like acupuncture as it targets specific acupoints, but practitioners use fingers instead of needles to apply pressure to stimulate these points. This massage is highly beneficial for endo sufferers as well, especially if you are scared of needles. Physiotherapy and osteopathy can also work well to help relieve specific muscle and joint areas of pain, especially in the pelvic region or if endometriosis pain affects the nerves running down the legs. Aromatherapy. Some oils can be used topically to help relieve menstrual pain. However, the main benefit of aromatherapy is stress, depression, and anxiety relief. Using an oil diffuser before going to bed with oils like lavender, chamomile, clary sage can help relax the mind, reduce stress, and promote deeper sleep. Some other natural methods, which are more controversial, are bioresonance, which is concentrated on sending magnetic frequencies throughout the body that stimulates certain areas, as well as remove harmful parasites, viruses, and bacteria that put a strain on specific organs of the body and immunity. Another option is sound healing. That method works with sound frequencies and vibrations such as gongs, Tibetan bowls, or voice that hit the brain and send healing signals for it to heal the sick areas of the body. They can also be quite helpful with stress reliefs, and it has similar effect to meditation. Of course, there are many other natural methods that I didn't mention in this presentation, but this is just to give you an idea of how many different options are available to you. Now let's move on to the advantages of natural healing. It's a bit like riding a bike, and by that I mean that you go at the speed and direction that you want to go. By using natural methods, you are targeting your body from different angles, from reducing stress to providing the right nutrients and supplements for your body, to removing the toxins and foods that harm it. By approaching the healing of endometriosis naturally, you are filling all the gaps that conventional medicine with endometriosis treatment protocols simply doesn't target. With natural treatment, you will be increasing your immunity, reducing inflammation and thus pain responses that you feel each month, and finally creating the mental space to get better by improving your overall wellness and reducing stress that can be a major trigger in endometriosis-caused pain. Now, this is not to say that your endometriosis will go away by natural methods alone, especially if you have larger cysts on your ovaries or endometriosis affects your bowel or urinary tract. A surgery just might be inevitable. However, even with such advanced stages of endometriosis, you can live mostly pain-free by using only natural treatment methods. You might not get to those results fast, but with persistence, slowly but surely, you will move towards your goal of living pain-free with lack of endometriosis symptoms. Now let's discuss the natural methods' advantages. First of all, natural methods have minimal or no side effects, and that's their biggest advantage. They will force you to focus on what methods work and don't work for you. That includes your lifestyle and your eating habits, because you will have to be the sole observer of your body and how it reacts to the methods you introduce, which will make you more conscious of your body and its reactions. Using natural methods will help you lower inflammation and thus the pain responses in your body that you're experiencing, as well as possibly slow down the disease progression. By reducing stress and fight or flight responses, you will directly reduce cytokine concentration in the blood that can aggravate endometriosis symptoms. Now, let's move on to the disadvantages of natural methods. There are 4 key areas that are not so much perhaps disadvantages, but that you have to do in order for natural treatments to work. Depending on the type of person you are and your schedule, you might find it inconvenient and bothersome. First, be patient. The results won't be immediate, as with prescription medication, and you might have to wait for up to 3 months and really work at it to start seeing any improvement in your symptoms. That's especially true if you have been running your body to the ground by having a lot of stressors in your life, a poorly chosen diet, and lack of any proper supplementation. Second, be open to experimentation. Each of us has a different body and different level and placement of the disease. So if something worked for you or for your other endo friend, it doesn't mean it will necessarily work for you. No 2 people are the same, and endometriosis is no exception. We also have different deficiencies and triggers that produce stress. While searching for the best natural treatment solutions, keep your mind open and observe how your body reacts and how you feel with each new method you introduce before you decide on your winning combination. Third, be organized. It is the key to stay regular with whatever you are doing and also start seeing results. You can use calendar reminders, different apps, or post-its to remind you of what you should do, eat, or take. Fourth, be persistent. Don't give up easily. Select a few methods before you introduce new ones, for example, diet, a few supplements, and a way to deal with stress, and give it a go for a few months so it doesn't become overwhelming and cause even more stress to your life while you're trying to reduce it. Now, let's move on to the medication treatments and their pros and cons. Types of pharmaceutical treatments for endometriosis concentrate either on simply stopping pain with non-steroidal anti-inflammatory drugs or manipulating the hormones released by the ovaries and pituitary gland by inducing amenorrhea, which is the stopping of the menses. Now, oral contraceptives like the pill have the combined estradiol progestin in them and are usually recommended by doctors to be taken continuously without the 7-day placebo break in order to stop regular menses from occurring. They are usually recommended for milder symptoms. Keep in mind, though, that as endometriosis is an estrogen-dependent condition, putting more synthetic estrogen in your body might have an effect on the progression of the disease, even if your symptoms get better. The progestin-only therapy mimics pregnancy by preventing follicular maturation and ovulation and suppressing the growth of endometrial implants. It may also reduce endometriosis-caused inflammation in the pelvis. Different options of progestin therapy are available, including a pill, an injection, and an intrauterine device, and the brand names of these will vary based on the country where you live. Another option that induces pseudomenopause is gonadotropin-releasing hormone agonists. They are the modified version of the natural GnRH hormone that stimulates the pituitary gland in the brain to secrete follicle-stimulating hormone, or FSH, and luteinizing hormone, LH, to start ovulation. When taken as part of endometriosis treatment, GnRH overload the pituitary gland to release more FSH and LH to the bloodstream, which produces more estrogen by the ovaries initially, which may worsen the symptoms. When taken continuously, the drug shuts down the ovaries and estrogen production rapidly decreases to make a woman stop menstruating and bring her into a pseudomenopause state. Another treatment available to induce pseudomenopause is the use of synthetic testosterone or androgens. These drugs affect both the decrease in estrogen and progesterone production by inhibiting the release of GnRH and follicle-stimulating hormones. However, as this treatment shows many side effects, including growing of facial and chest hair and lowering of the voice, it is not often prescribed by doctors as the first line of treatment. Choosing to go with hormonal therapies treatment prescribed by your doctor is a bit like being a passenger in the car. You are getting to some destination fast and you will get fast results. However, neither you are driving the car anymore, nor do the methods prescribed guarantee your well-being. Since you are not the driver of the car, You have to depend on being told by your doctor what to do and hope that the treatment prescribed will work as expected for you with minimal side effects and maximum benefits. Now let's discuss the advantages of pharmaceutical treatment. There are definitely a few, and for a lot of women, the advantages surpass the kickbacks. One of the major advantages is that hormonal therapy works fast, and much faster than natural treatment can guarantee, as they chemically alter how your body works and responds. If your body tolerates the synthetic hormones, you might get a reduction of pain by stopping your period and stopping the progression of endometriosis. Another advantage of this method is that it's easy as taking a pill or an injection. Unlike natural methods, it's definitely not as time consuming and technically doesn't require any special dietary supplementary arrangements, so you can just continue your normal lifestyle. Third advantage is that your doctor is in control of your prescription. You don't have to figure out how and what to take and in what doses. It will all be in your prescription, and you just need to follow what your doctor prescribes. This is great for people who trust their doctors and prefer people with authority to tell them what to do or take. Now let's look at the disadvantages, of which unfortunately there are many. This is mainly due to the various side effects of hormonal therapy that manipulates the natural hormones within the body that aren't just responsible for menstruation and female features, but also for the increase of good cholesterol and lowering of the bad cholesterol, as well as involved in the process of bone creation, among many other aspects. That's why lowering of estrogen can have various serious downsides, including issues with blood cholesterol and higher risk of bone density loss that can lead to developing osteoporosis. To give you a glimpse of the many milder and more severe side effects, which can happen depending on the type of hormonal therapy you choose, here is a comprehensive list of the side effects you may experience and be at risk of. In the table, as you can see, in the mild side effects, you might experience night sweats, hot flashes, skin issues, fatigue, fluid retention, while with the severe side effects, you might be in an increased risk of ovarian breast cancer. You might get decreased bone density that can lead to osteoporosis. You might be in the increased risk group of getting blood clots, which can lead to deep vein thrombosis, and increased risk of pelvic inflammatory disease. Now, another big downside is that if you're trying to get pregnant with hormonal therapy, you might have problems conceiving due to the decreased ovulation and reduction of the endometrial tissue inside the uterus. It is also not recommended to try and get pregnant while on any of the hormonal medication, as it can harm the developing fetus and put the pregnancy at risk. If you think about mixing natural and medical methods, you might also reconsider some of the methods like certain herbal teas and supplements that haven't been studied in terms of counteracting the synthetic hormones, and that when mixed together could either increase or decrease their effect on your body. In addition, pharmaceutical methods only concentrate on one area of the body, without the holistic approach of looking into diet deficiencies, diet allergies, vitamin and microelement deficiencies, the intestinal flora, lowering of the inflammation, increasing of immunity, or stress factors like in a person's life to truly help target endometriosis symptoms on all levels without the need for strong hormonal drugs. In the end, though, the choice is yours to go with natural or pharmaceutical methods, and is definitely a difficult one to make. However you decide, have a plan in place. If you decide on one or the other, have a timeline definition of how long you are willing to try one approach over the other and see how it works for you. With pharmaceutical method, you might have to test different types of drugs before you find one with minimal side effects that will target your symptoms. With natural methods, you will have to do the same, but in addition, you might have to give up a lot of things you are used to and work harder at it for the method to work for you and improve your symptoms. Remember, natural methods are not as potent or strong, but when used for a longer time, they give lasting effects. So, I encourage you to ask yourself the questions: what are you willing to sacrifice and for how long? How long are you willing to try it for? What side effects are you willing to sustain? What exact symptoms are you trying to minimize? Answer these questions to yourself openly and honestly, because only you truly know your body, and only you, not your doctor, not your spouse, nor your friends, will live with the consequences of that decision. Think about it and take responsibility for your actions and choice. Lastly, it is important to keep in mind that endometriosis is a disease whose origin is not confirmed by science and for which there is no one protocol that works for all women affected. A method that worked for your friend or sister who has endometriosis may not necessarily work for you. We are all different in our experience of endometriosis. However, not giving up and finding a cure that works for you is what really matters in the end, not just for your health and pain-free lifestyle, but for your holistic physical and mental well-being. Many thanks for watching, and if you found this video informative, please give me a thumbs up and subscribe to my channel, as well as follow me on Facebook so I can keep providing you with more content about endometriosis treatment options and natural approaches to minimizing the impact of the disease on your life. Thank you and have a great day.